Welcome to Holistic Health Conspiracies, Truth or Deception. I'm your host, Dr. Sue Williams from Quantum Holistic Health. In this podcast, we dive into the intriguing and sometimes confusing world of holistic health and wellness, uncovering the secrets, controversies, and conspiracies that shape our understanding of natural healing. Now, in this episode, we're diving into the fascinating world of the placebo and nocebo effects. I have mentioned the placebo effect many times in other episodes of this podcast, so today we will investigate just what this effect is and what it does. And we have to ask, how powerful is the mind in influencing our health? Can belief alone heal or harm us? Join me as we explore the power of belief and its profound effects on our well-being. So firstly, let's introduce the placebo and nocebo effects. And let's start by defining what we mean by the placebo and nocebo effects. The placebo effect occurs when a person experiences a real improvement in their symptoms after receiving a treatment that has no therapeutic value. This effect highlights the power of positive thinking and belief in the efficacy of a treatment. On the other hand, the nocebo effect is the opposite. It occurs when negative expectations lead to worse symptoms or side effects after receiving a harmless treatment. This effect underscores the potential harm that negative beliefs and anxieties can have on our health. Now, let's look at the historical context and key studies in this area. The placebo effect has been recognized for centuries, even before it had a name. In ancient times, healers used various rituals and remedies that, while not necessarily effective on their own, produced positive outcomes due to the strong belief of the patients. One of the earliest documented studies on the placebo effect was conducted by Dr. Henry Beecher during World War II. Faced with a shortage of painkillers, Beecher administered saline injections to injured soldiers, telling them that it was morphine. Remarkably, many soldiers reported significant pain relief, showcasing the power of belief. In modern times, numerous studies have further explored the placebo effect. One notable study published in the New England Journal of Medicine in 2001 involved patients with osteoarthritis of the knee. Some patients underwent real surgery, while others received a sham surgery where only an incision was made. Surprisingly, both groups reported similar improvements in pain and function, illustrating the placebo effect's powerful roles in perceived healing. Now let's look at the mechanisms behind the placebo effect. So how does the placebo effect work? While the exact mechanisms are still being studied, several factors contribute to this phenomenon. Firstly, the expectation. Belief and expectation play a crucial role in the placebo effect. When patients believe they are receiving an effective treatment, their brain releases chemicals like endorphins and dopamine, which can lead to real improvements in symptoms. The body treating itself, in effect. And there's conditioning. Classical conditioning also plays a role. If a person has experienced relief from a particular treatment in the past, they may be conditioned to respond positively to it again, even if the treatment is inert. What about the brain-body connection? The mind and body are deeply interconnected. Positive beliefs and expectations can trigger physiological responses that promote healing. This connection is evident in practices like meditation and mindfulness, which harness the power of the mind to improve physical health. Now let's look at the nocebo effect. Let's dive into the darker side of belief, which is the nocebo effect. Just as positive expectations can lead to real improvements, negative expectations can result in real harm. There are negative expectations, and when patients expect negative side effects or believe a treatment will not work, their bodies can produce symptoms that align with these beliefs. This can lead to increased pain, nausea, and other adverse effects. What about the role of anxiety in all this? Anxiety and fear can amplify the nocebo effect. When patients are anxious about a treatment, their stress levels increase, leading to physical symptoms that can worsen their condition. Now, communication is very important in this area, and how information is communicated to patients can also influence the nocebo effect. If healthcare providers emphasize potential side effects, the downside of treatments, patients may also be more likely to experience these symptoms due to heightened anxiety and expectation. Now let's look at some case studies and real-world examples. Some real-world examples and case studies that illustrate the placebo and nocebo effects in action are these. Firstly, the placebo effect in depression treatment. A study published in the JAMA Psychiatry publication found that patients with depression who believed they were receiving an effective treatment experienced significant improvements, even when given a placebo. This highlights how powerful belief and expectation can be in managing mental health conditions. The second case study is the nocebo in medication side effects. In another study, patients who were informed about the potential side effects of a medication were more likely to report those side effects, even when given a harmless sugar pill. This demonstrates how the nocebo effect can be triggered by negative expectations and information. So, what are the implications of this area for healthcare? The placebo and nocebo effects have significant implications for healthcare. Understanding these phenomena can help healthcare providers improve patient outcomes and reduce unnecessary side effects. Firstly, let's look at enhancing positive outcomes. By fostering positive expectations and beliefs, healthcare providers can enhance the efficacy of treatments. This can be achieved through effective communication, building trust, and emphasizing the potential benefits of a treatment. And minimizing negative outcomes. To minimize the nocebo effect, it's important for healthcare providers to communicate potential side effects carefully and compassionately. Balancing the need for informed consent with the potential for inducing negative expectations is crucial in these interactions between the patient and the therapist. So, what about integrative approaches? Integrating mind-body practices like meditation, mindfulness, and cognitive behavioral therapy, or CBT, into treatment plans can harness the power of the mind to improve physical health and well-being. And what about the power of belief in everyday life? The power of belief extends beyond clinical settings and into our everyday lives. Cultivating a positive mindset can have profound effects on our overall health and well-being. Good old positive thinking. Embracing positive thinking and maintaining an optimistic outlook can boost our immune system, reduce stress, and improve our quality of life. And there's also visualization and affirmations. Practices like these can help us achieve our goals and enhance our self-confidence. By visualizing success and repeating positive affirmations, we can reprogram our minds to focus on the positive. And what's the role of all this in the support systems? Having a strong support system of friends, family, and healthcare providers who reinforce positive beliefs can significantly impact our health outcomes in a very positive way. So in conclusion, the placebo and nocebo effects highlight the incredible power of belief in influencing our health. While the scientific community continues to study these phenomena, it's clear that our minds play a crucial role in our well-being. By understanding and harnessing this power, we can improve our health outcomes and lead more fulfilling lives. Thank you for joining me on this exploration of the power of belief and its effects on our health. If you enjoyed today's episode, please subscribe, rate, and leave a review. Your support helps us continue to investigate interesting and insightful content on holistic health conspiracies. So, from me, Dr. Sue, until next time, stay curious and stay healthy.